Hi all, welcome to EC Nursing Education by EC. So last class we have discussed the unit number 5. So we will continue with the same chapter. So the second portion or second part of this chapter, let's discuss. So first we are going to discuss about neurotic disorders. So what is neurotic disorders? Let's see. So neurotic disorder, it's a type of mental illness distinguished by excessive worry, dysfunctional coping techniques, frequently without loss of contact with reality. So it's a neurotic disorder. It's nothing but it's causing excessive worry to a person, dysfunctional coping techniques, and frequently without loss of contact with reality. So that is the definition of neurotic disorder. So we are going to discuss one by one what are the neurotic disorders. So the first one is phobia. So what is phobia? Phobia is an unreasonable, strong and persistent dread of a particular object, place or activity that causes avoidance behavior. So that person will be very much afraid of one situation or one object or also one place. So he or she will try to avoid that. That is what called phobia. So it's nothing but a fear of something. So that is what called phobia. So phobias can be severely interrupt a person's everyday life and functioning, producing misery and impairment in many areas of life. So phobia is nothing but a person will have a fear about something. So it's a huge fear about something it's adversely affecting his day-to-day life. Then it is known as phobia. Yes. So let's discuss about types of phobia. So it is first one, specific phobia. So what is specific phobia? These are fears of specific items or situations. So it's related to they have a fear of particular item or situation such as spider. So the person is having spider phobia. Then what it is known as? It is arachnophobia. Height. If particular height, if the person is going, so they'll also feel fear about heights. Then it is known as acrophobia. Flying, it is aviophobia. And enclosed phase, that is claustrophobia. So like a lift, if that person is going inside the lift and they'll feel fear and anxiety, then it is known as to confined phase, it is a fear, then it is known as claustrophobia. So this is specific phobia. Coming to social phobia. So what is social phobia? It is social anxiety disorder characterized by fear of being negatively judged or evaluated by others in social circumstances. So that person will have a fear that he or she will be judged negatively in the society. So resulting in avoidance of social interactions and performance anxiety. So that is what called social phobia. Next is agoraphobia. So what is agoraphobia? It is the fear of being in situations or locations where living would be difficult and embarrassing. So sometimes the places, so situations or location where that person will feel fear and embarrassing, such as crowded setting or open spaces. It frequently accompanies with panic disorder. So that person will also, with agoraphobia, that person will also feel panic, anxiety disorder. So these are the types of phobia. So what is phobia? Fear of something that is interfering with the day-to-day life of a person. So it is types of specific phobia, social phobia and agoraphobia. So next we are going to discuss about the causes of phobia. So what are the main causes? First one is genetic factors. So what are the genetic here? There may be genetic predisposition to developing phobia as they tend to run in families. So from the genetics, from the father to the mother, from the parents to the baby. So it's running in the family. So that is genetics. Second one is traumatic experiences. So phobias can develop after experiencing or witnessing a traumatic event related to feared object or situation. So in the childhood period, that person witnessed about a road traffic accident. So he or she will have also there is a chance of developing the phobia. So that is what called because of the traumatic experiences. Next one is learned behavior. So what is learned behavior? Phobias can be learned through observation and conditioning. Example, a child may develop fear of dogs after witnessing parents' fearful reaction to them. So if the parent is afraid of dog, so the child is witnessing that. So the child also may develop the phobia against the dog. So that is what called learned behavior. Fourth one is brain chemistry. So it is imbalances in the neurotransmitters and brain activity play a role in development of phobia. So there is imbalances in the neurotransmitters and in the brain activity also will causes phobia. Next, fifth one is environmental factors. So what are the environmental factors? Stressful life events or environmental factors may contribute to onset or of phobia. So environmental factors, stressful environmental factors also one of the factors that leads to phobia. So these are the main causes of phobia. Now let's discuss about the symptoms of phobia. So what are the symptoms of phobia? Intense, irrational fear of specific objects, situations or activities. So that person will have intense, say it's specifically intense, irrational fear of specific object or situation or activity. So that's a must one. Second one, anxiety or panic attack when exposed to the phobic stimulus. So when person is exposed to the phobic stimulus, that person will have anxiety or panic attack. Next one is avoidance behavior to prevent encountering the feared object or situation. So that person will avoid the situations or that specific objects that is causing the phobia. So avoidance behavior. Next is physical symptoms. So what are the physical symptoms that person will experience? Rapid heartbeat, sweating will be there, trembling, shortness of breath in responses to the phobia. Also distress or impairment in daily functioning due to the phobia. So these are the symptoms of phobia. Next, we are going to discuss about the treatment of phobia. So what are the treatment here? First one is CBT, cognitive behavior therapy. Challenges irrational thoughts and gradually exposes to feared stimulus. So we'll challenge the situation and that person will gradually expose to the fear situation. So the phobia. Also medication. Antidepressants like SSRIs, that is selective serotonin reuptake inhibitors, benzodiazepine are given to alleviate the symptoms. Exposure therapy. Next is systematic exposure to feared stimuli to reduce anxiety. So that person will be systematically exposed to that fearing situation. So that is what called exposure therapy. Next is relaxation technique. Deep breathing, meditation or progressive muscle relaxation can help in the management of anxiety. Support groups, participating in groups for encouragement and coping strategies. So these are the treatment protocols or treatment that is used for phobia. I hope everyone understood phobia. So now let's discuss about another disease condition, that is anxiety disorder. So what is anxiety disorders? Let's see. So it's a mental health illness marked by excessive anxiety, fear and apprehension. These illnesses can have a major impact on everyday functioning and quality of life. So it's a anxiety disorder marked by that person will have excessive anxiety, fear and apprehension. So what are the types? So here generalized anxiety disorder. Generalized anxiety disorder. So what is generalized anxiety disorder? It is characterized by continuous and excessive concern about different elements of life, including job and relationships, without a specific trigger, hindering everyday functioning and causes severe discomfort. So here that person will have an excessive concern about different events in the life. He will be very much anxious about the elements in the life also, including his job, his relationships, without any specific trigger. So without any reason also they will feel anxiety, hindering everyday functioning. So that is what called generalized anxiety disorder. Here second one is panic disorder. So what is panic disorder? It is frequent panic attacks. So that person will have frequent panic attacks which cause severe fear or discomfort and physical symptoms such as, so that persons will have a physical symptoms such as palpitations, perspiration and shortness of breath. So panic attack will occur. This can lead to avoidance behavior and impairment in daily activities. So this is the types: generalized anxiety disorder and panic disorder. Now coming to the causes. So what are the main causes? First one is genetics. The individuals with a family history of anxiety disorder may be at risk. So the family, if that person, any of the person is suffering with anxiety disorder, this next generation also may chance of getting anxiety disorder. So that is genetics. Next one is brain chemistry. So what is brain chemistry? So imbalance in neurotransmitters such as serotonin, dopamine and gamma aminobutyric acid can contribute to anxiety disorder. So any imbalances in the neurotransmitters by produced in the brain. So neurotransmitter imbalances like serotonin, dopamine and gamma aminobutyric acid. So there is a chance that person will have excessive anxiety disorder. Next is environmental factors. So what are the environmental factors? Stressful life events, trauma, childhood adversity and major life changes can increase the risk of developing anxiety disorder, along with personality factors. So what are the particular personality factors? Like certain personality traits such as high levels of perfectionism. So that person is having an attitude of high level of perfectionism may predispose to individuals to anxiety disorders. So this is the definition of anxiety disorder, types and also causes. Now we are going to discuss about the diagnosis of anxiety disorders. How we can diagnose it? So it is physical examination and medical history. So through physical examination and medical history, psychiatric assessment, psychological questionnaires and assessment, diagnostic criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. So these are the main diagnostic measures in the case of anxiety disorders. Now let's discuss about treatment. So what is the treatment here? First one is psychotherapy. So the psychotherapy like CBT, cognitive behavioral therapy, exposure therapy and mindfulness based therapies that are frequently beneficial in treating anxiety disorder. So by using the psychotherapy, there is a chance this is frequently benefiting the persons with anxiety disorder. Next treatment is medication. So how the medications works here? Like antidepressants such as selective serotonin reuptake inhibitors, so SSRIs, or serotonin norepinephrine reuptake inhibitors, SNRI. So that's the treatment, as well as benzodiazepines may be administered. So antidepressants we are using here in the case treatment of anxiety disorders. Also lifestyle changes. So what are the lifestyle changes? Regular exercises, enough sleep, stress management strategies such as deep breathing or meditation, and avoiding caffeine and alcohol can reduce the symptoms of anxiety. So that is also one of the main factor, avoiding of caffeine or alcohol. Coming to support groups. So what is support groups? Participating in support groups or seeking help from friends and family can provide emotional support and encourage while in therapy. So these are the main treatment protocols in the cases of anxiety disorders. Now let's discuss about obsessive compulsive disorder, that is OCD. So OCD, it's a very common word. OCD, what it is? It's a persistent unwanted thought, or that is known as obsessions, and repetitive behavior or mental acts known as compulsion. So the person will have a persistent unwanted thoughts and a repetitive behavior or mental act. This obsessions and compulsion can severely disrupt everyday tasks, relationship and general quality of life. So it is nothing but it's a persistent unwanted thoughts and repetitive behaviors. So what are the types of OCD? First one is contamination OCD. So what is contamination OCD? Obsession related to contamination or dirt. So that person will think contamination or dirt, obsession related to, leading to compulsive cleaning and avoidance behavior. So highly cleaning. So if they are thought, oh, there is a dirt, they will have a obsession to the dirt, then they'll definitely do the vigorous cleaning of that. So that is what called contamination OCD. It's obsessions related to contamination or dirt leading to compulsive cleaning or avoidance behavior. Next one is checking OCD. So what is checking OCD? Obsessions about harm or danger, leading to compulsive checking of things like locks, appliances or personal health. So if they lock their cupboard, so they are thinking that there is harm and danger. So every time they will go and check it. So it is open or it is closed. So they already closed it then also. That is checking OCD. Next is symmetry and ordering OCD. So what is symmetry and ordering OCD? Obsessions regarding order, symmetry or exactness, leading to compulsive arranging or organizing. So in the cupboard, arranging the clothes. So already he or she arranged but they have that OCD, they'll rearrange everything. They'll take out, they'll again arrange, they'll take out, they'll again arrange. That is what called symmetry or ordering OCD. It is obsessions regarding order, symmetry. They need what are the things they are keeping, they need them in an order or symmetry or exactness, leading to compulsive arranging and organizing. So that is symmetry and ordering OCD. Now coming to hoarding OCD. So what is hoarding OCD? Obsession around collecting and keeping items. So they have obsession about collecting and keeping the items, some particular items, even if they have little or no value at all, leading to compulsive hoarding of behaviors. So it is having that thing, that item should not have any value. It does not have any value, but also due to their obsession, they'll collect and they'll keep them. So that is what called hoarding OCD. So the next one is intrusive thoughts. So what is intrusive thoughts? Persistent, distressing thoughts or mental images that intrude into consciousness, causing significant distress. So it is a distress ideas or thoughts will come into his mind. So mental images that will intrude into the consciousness. That is one known as intrusive thoughts. So these are the types of obsessive compulsive disorder. I hope everyone understood. So coming to causes, what are the causes of OCD? It is genetic predisposition. So genetic predisposition like family history of OCD or related disorders increases risk. So the person's already, if the family, it is the person is suffered, any person is suffered, there is a chance also genetic predisposition, it will run in the families. Next is neurobiological factors. Like what are the factors here? Imbalances in brain chemicals like serotonin play a vital role. So the imbalances in the serotonin levels. Next is brain abnormality. So what is brain abnormalities here? Differences in brain structure or function, particularly in areas related to emotional regulation and decision making. So any differences in the brain areas of emotion regulation and decision making. Next is environmental triggers. What are the environmental triggers here? Stressful life events or trauma can contribute to the development of OCD symptoms. So if they had a stressful life event or trauma, that also will lead to OCD. And learned behavior. Early experiences or reinforcement of certain behavior may influence the development of OCD. So that person, example, that person is ordering the things. From the childhood itself, he got a positive reinforcement. So it also, from there that he will learn, oh, this will give me a benefit, give me a positive reinforcement. So that will continue into OCD. So that is what called learned behavior. So these are the main causes of OCD. Now let's discuss about symptoms of OCD. So what are the symptoms of OCD? Let's see. So it is obsession, intrusive, unwanted thoughts, images or urges. So they will have a obsession to intrusive, unwanted thoughts will be there, images also urges will be there. Next is compulsion, repetitive behavior or mental act. So that person will have a repetitive behavior like arranging, rearranging, again rearranging. So that is what called compulsions. Fear of contamination or dirt. So they are having a fear of contamination and dirt. Doubt about safety or harm. So they will have a thought of doubt about the safety of half of them. Harm and need for symmetry or exactness. So they need exactness or organized or symmetry in their life, and excessive checking, cleaning or arranging. Ritualistic behavior to reduce anxiety. So these are the symptoms of OCD. Coming to the diagnosis of OCD, how we can diagnose it? It is comprehensive assessment by mental health professionals. So by the mental health doctor, psychiatric doctor or the mental health professional, comprehensive assessment. And the Diagnostic and Statistical Manual of Mental Disorders, DSM-5 criteria also is used to determine the presence of obsessions or compulsions that significantly affecting the daily living. So this is the diagnosis for OCD. Coming to the management of OCD. So how we can do the management? Like first one is psychotherapy, cognitive behavior therapy, particularly exposure and response prevention. So exposure and response prevention is the most effective psychotherapy for OCD. So mainly cognitive behavior therapy and particularly exposure exposure and response prevention. It helps people gradually address scary circumstances and thought and build healthy coping strategies. So it's slowly helping the people to come back to the normal, so to reduce the obstructions and compulsions. Next is medication. So what are the medication treatment or pharmacological drugs here? Selective serotonin reuptake inhibitors, SSRIs, and commonly used to treat OCD symptoms by boosting serotonin levels in the brain. So that is the main treatment. It is selective serotonin reuptake inhibitors. Next is self-help strategies. So what are the self-help strategies here? Mindfulness, stress management and relaxation activities they need to do by themselves can help in the supplement formal treatment. Next is support groups. So what is support groups? Connecting with other people who have OCD can provide understanding, encouragement and coping skills. So connecting with the people who is suffering with OCD. Also, healthy lifestyle practices like regular exercise, proper sleep and a balanced diet can promote general well-being and aid in the management of OCD symptoms. So these are the general and particular management for OCD. So I hope everyone understood OCD, that is obsessive compulsive disorder. Now let's discuss about post-traumatic stress disorder. So what is post-traumatic stress disorder? It is a psychiatric disease that can emerge in those who have been through or observed a traumatic event. So after that person experienced a traumatic event, they will have this disease, that is PTSD. Post-traumatic stress disorder. Post means what it is after the stressful event. So after the traumatic, that person will develop post-traumatic stress disorder. So it's a psychiatric disease that can emerge in those who have been through or observed a traumatic event such as natural disaster, an accident, an assault or another life-threatening circumstances. So the person have experienced a trauma. So there is a chance that person may develop post-traumatic stress disorder. So that's a definition. Coming to the causes. So what are the causes here? It is combat exposure. So exposure to a particular stressful event or a traumatic experience. Sexual or physical assault. So that person had undergone any sexual or physical abuse or assault. Natural disasters, serious accidents, childhood trauma such as abuse or neglect. So these are the main causes of PTSD. Coming to the symptoms of PTSD. So what are the symptoms here? It is intrusive memories. So they'll have flashbacks, nightmares and distressing memories of the event. So they'll have a flashback or after the sleep, they'll get nightmares and also distressing memories of the traumatic event. Next one is avoidance. So what is avoidance? Avoiding that places. So they'll avoid that places, that people and the activities that reminding the individual of particular trauma. So that person has experienced a trauma. So what are the things causing or remembering, or what are the incidences that remembering that or trauma? So that person will avoid it, and they also may avoid talking about it. Next is negative changes in thinking and mood. So negative thoughts and feelings they'll develop, including guilt, shame and hopelessness, loss of interest in previously enjoyable activities, feelings of detachment and difficulty experiencing positive emotions. So that are these are the symptoms that person with PTSD will develop. Next is changes in physical and emotional reaction. So what are the changes will be there? Hyperarousal, including difficulty in sleeping, irritability, angry outburst and exaggerated responses. So these are the main symptoms of PTSD. Let's move to management of PTSD. First one is therapy. So what is therapy? Psychotherapy will use here, particularly CBT, cognitive behavior therapy, and exposure therapy is often effective in treating PTSD. These therapies help individual process traumatic memories and develop a coping strategies. Next is medication. So what is medications we are using here? Antidepressants and anti-anxiety medications prescribed to help manage symptoms like depression, anxiety and insomnia. Support groups. So what is support groups here? Joining support groups for individuals with PTSD can provide validation, understanding and also encouragement from others who have experienced the similar trauma. So they'll meet up with the persons who have experienced similar trauma, they'll get encouraged, it is helping emotionally, and also they'll give a encouragement, understanding and also a validation. Next is lifestyle changes. Engaging in regular exercises, maintaining a healthy diet, practicing relaxation techniques such as meditation or deep breathing, and also avoiding alcohol and drugs can help alleviate symptoms. Next is education. So what is the education use here? Learning more about PTSD and understanding its effects can empower individuals to cope better with their symptoms and seek appropriate treatment. So these are the management used in the cases of a PTSD. Now let's discuss about another disease condition, that is substance use and de-addiction. So what is substance use? It's a usage or indigestion of psychoactive substances such as drugs, alcohol, which frequently result in altered mental status or psychological effects or physiological effects. So it's nothing but the use of substances that is hindering in your life activity or is resulting in altered mental states. So what is alcoholism? So alcoholism is very common. Alcohol is very common. So alcoholism is defined as compulsive and excessive alcohol drinking. Compulsive and excessive alcohol drinking, notwithstanding its harmful effects on physical health, mental well-being and social connection. So it is notwithstanding with the harmful effects on physical health, mental well-being and social connection. So it is alcoholism defined as excessive and compulsive drinking of alcohol. What are the stages of alcoholism? So first one is pre-alcoholic stage. Individuals begin to use alcohol as a coping mechanism for stress or other issues, but consumption remains controlled. So their consumption is controlled, but they'll think if one stress is there, they'll start to drink. So the starting to drink, begin to use alcohol as a coping mechanism for a stress. Next is early stage. So the second one is early stage, where drinking becomes more frequent. So that person will start more frequently drinking and tolerance begins to develop. Social and occupational functioning may start to decline. So here this person will drink frequently and it will disturb his social and function. And middle stages, alcohol dependence deepens. So here alcohol dependence deepens, leading to loss of control over drinking and increased tolerance. So they'll have a loss of control. They'll definitely drink every day more. And physical and psychological health problems may become more apparent. So it will also cause physical and psychological problems. Next is late stages. So what is late stages? Individual's life become dominated by alcohol. So the individual's life is only dominated with the alcohol, with severe physical and mental health complications. Relationships, environment, employment and overall functioning suffer greatly. So their relationship, their employment, their overall life only will be affected in the late stages. Chronic stage. So what is chronic stage? In this final stage, alcoholism reaches its most severe form. So it is the most severe form the alcoholism will reach, often accompanied by organ damage, cognitive impairment and social isolation. Without intervention, this stage can be life-threatening. So these are the stages of alcoholism. It is pre-alcoholic stage, early stage, middle stage, late stage and chronic stage. Now let's discuss about the causes of alcoholism. First one is genetics. So it will run in the families, neurobiology, psychological factors, environmental influences and developmental factors. So these are the main causes of alcoholism. So what are the symptoms here? Increased tolerance to alcohol. So that person will have increased tolerance to alcohol. Withdrawal symptoms when not drinking, like hand tremors, unconsciousness. So that person will have withdrawal symptoms. Loss of control over alcohol consumption. Inability to limit or stop the drinking. So that person is unable to stop the drinking. Preoccupation with obtaining and consuming alcohol. So they are only thinking about obtaining and consuming alcohol. Neglecting responsibilities and hobbies in favor of drinking. So when they start drinking, they'll neglect all the responsibilities. Also, continued alcohol use despite negative consequences. Craving for alcohol. So if one time they are not getting, they'll have a craving to have the alcohol. spending a significant amount of time in drinking or recovering from its effect. Like full night they will drink and full daytime they will sleep, recover. So that is what called spending a significant amount of time in drinking or recovering from its effect. Relationship, work and legal problems related to alcohol. So it will break all the relationships, its works and the legal issues also will occur. So these are the symptoms of alcoholism. Now coming to alcoholism related disorders. So what are the related disorders? Alcoholic amnestic disorder. It is amnestic syndrome. Memory impairment and cognitive deficit due to chronic alcohol abuse. So that person have chronic alcohol abuse, there is a chance that person's memory impairment will be there. So that is alcoholic amnestic syndrome. Next is alcoholic psychosis. So what it is? Psychotic symptoms such as hallucinations and delusion. So that person will develop hallucinations and delusion resulting from excessive alcohol consumption. Delirium tremens or tremors. What is it? It is nothing but severe alcohol withdrawal syndrome characterized by tremors, confusion, hallucination and autonomic instability. So that person will having tremors, shaking of hands, hallucinations, confusions, also autonomic instability. Alcohol withdrawal syndrome. Collection of symptoms include anxiety. So this person will alcohol withdrawal symptoms. What are the symptoms will be there? Anxiety, tremors, nausea, sweating occurring when alcohol consumption is abruptly reduced or stopped. So these are the alcoholism related disorders. Coming to the management, it is first one medical stabilization. So first we need to keep the patient or person in medical stabilization. Involves addressing acute physical and psychological complications of alcohol withdrawal through medication and medical monitoring, ensuring patient safety and stability. Next is detoxification. So what it does? Processing, eliminating alcohol from the body while managing the withdrawal symptom, often conducted under medical supervision to minimize discomfort and risk associated with withdrawal. Rehabilitation. Comprehensive treatment program focusing on addressing underlying issues, providing therapy, support groups and skill building to promote long-term recovery and also preventing relapse. So this is the management of alcoholism. Now we are going to discuss about another disease condition, that is eating disorders. So what is eating disorders? Are mental health condition characterized by unhealthy relation with food, often involving extreme behaviors related like extreme eating, exercise and body weight. So what are the types? Let's see. First one is anorexia nervosa. So what is anorexia nervosa? Characterized by extreme food restriction. That person will have extreme food restriction, fear of gaining weight and distorted body image. So they'll think that after having food, so they'll get the weight and the body will be, the image will be changed. So that person is known as anorexia nervosa. That person suffering with this eating disorder is known as anorexia nervosa. It is nothing but characterized by extreme food restriction, fear of gaining weight and distorted body image. Second one is bulimia nervosa. So what is bulimia nervosa? Involves cycles of binge eating followed by purging behavior such as vomiting or excessive exercise. So that person will have food, binge eating, that person will have eating, but after the eating, he or she will vomit, try to vomit it and do the excessive exercises to not to gain the weight. So that is bulimia nervosa. Next one is binge eating disorder. So what is binge eating disorder? Marked by recurrent episodes of uncontrollable eating. So that person is uncontrollably, he or she will eat and often without compensatory behavior. So that is binge eating disorder. And next one is pica. So what is pica? It is eating disorder characterized by persistent consumption of non-nutritive, non-food substances. So the person is eating food, but it is not the exact food. What they will eat? Dirt, chalk or paper. So that condition is known as pica. Next one is night eating syndrome. A disorder characterized by recurrent episodes of nighttime eating. So that person will have nighttime eating, often involving excessive food consumption and insomnia. So in the night they'll have excessive food. So they'll have sleeping disorders. So sleep will be less. That is insomnia they'll develop. So now let's discuss about the causes of eating disorders. So what are the main causes? Genetic predispositions and family history. So genetic predisposition and family history. Psychological factors such as low self-esteem, perfectionism or trauma. So they have a low esteem or perfectionism they need or any trauma. Sociocultural influences like including media portrayal of idealized body type. So they are seeing the social media. So the idealized body type they need. So they start to do the eating. They'll eat and vomit or do exercise, or they'll avoid or restrict the food only. So dysfunctional coping mechanism for stress, anxiety or depression. Imbalance in brain chemical regulating appetite, mood and impulse control. So the imbalance in the hormones or the brain chemical that is regulating the appetite of a person. Negative body image and dissatisfaction with the appearance. Childhood experiences such as teasing, bullying or abuse affecting body perception and eating habits. So these are the causes. These are the causes of eating disorders. Now let's discuss about the symptoms of eating disorders. So significant weight loss or fluctuation will be there. So significantly that person's weight will be lost. Obsession with food, calories and dieting. Also preoccupation with body images and weight. Compulsive excessive routines or exercise routine. They will vigorously or excessively do the exercises. Avoidance of social gathering involving food, like going into a marriage reception or a birthday party. So avoidance of social gathering. Secretive behavior around eating habits and development of rituals or strict food rules. They will have withdrawal from usual activities and relationship. Mood swings, irritability or depression may develop. Physical signs such as fatigue, fatigue, dizziness or hair loss will be there. So these are the symptoms of eating disorders. Let's move on to the management. Here, medical evaluation and treatment to address the physical complications. So we need to assess physical examination and also we need to assess the physical complications. Psychotherapy such as cognitive behavior therapy to address the underlying psychological factors. Nutritional counseling to establish healthy eating pattern and attitudes towards the food. Support groups and family members to provide additional support and understanding. Medication in some cases to manage symptoms like depression or anxiety. Hospitalization or residential treatment for severe cases requiring intensive care and also monitoring. Long-term follow-up and support to prevent relapse and promote recovery. So these are the management of eating disorders. Next, we are going to discuss about sexual disorders. So what are sexual disorders? Refer to range of conditions that impair sexual desire, arousal or function, causing distress or interpersonal difficulties, often resulting in challenges with sexual satisfaction or fulfillment. So it's nothing but a range of conditions that impairing the sexual desire of an individual. So what are the types of here? First one is sexual dysfunction. It encompasses difficulties with sexual desire, arousal, orgasm or pain, disrupting the normal sexual response cycle and affecting intimate relationships. So that is sexual dysfunction. Next is disorders of sexual preference. Involve atypical patterns of sexual arousal such as paraphilias, which may cause distress or impairment in the daily functioning. Gender identity disorder refers to incongruence between one's assigned sex at birth and their experienced or expressed gender identity, often causing significant distress and requiring support and understanding. So these are types of three main types of sexual disorders: sexual dysfunction, disorders of sexual preference and gender identity disorder. Let's discuss about the causes of sexual disorders, that is psychological factors like stress, anxiety, depression, trauma or relationship issues can disrupt sexual desire, arousal and function. Next is medical condition like chronic illnesses, hormonal imbalances, neurological disorders or medications that interfere with the sexual response. Lifestyle factors like substance abuse, smoking, poor diet, lack of exercise or sleep disturbances can also contribute to sexual dysfunction. Trauma and abuse. Past experiences of sexual abuse, assault or trauma can lead to various sexual disorders and challenges with intimacy. So these are the causes of sexual disorders. So now coming to the symptoms. What are the symptoms of sexual disorder? Decreased sexual desire or interest, difficulty in achieving or maintaining arousal, pain during intercourse, premature or delayed ejaculation, inability to achieve orgasm, atypical sexual fantasies or behaviors, gender dysphoria or incoherence, avoidance of sexual activity, relationship conflict or distress related to stress, so sex. So these are the main symptoms of sexual disorders. Coming to the management, first one is medical evaluation. Comprehensive assessment to identify the underlying medical, hormonal and neurological factors. Therapy, so psychotherapy or counseling to address psychological issues, trauma or relationship difficulties. Medications, prescription of drugs such as Viagra for erectile dysfunction or hormone therapy for hormonal imbalances. Lifestyle changes, healthy habits including exercise, diet and stress management. Sexual education, providing information about sexual health, communication and also techniques. Support groups, peer support for individuals and also couples dealing with sexual disorders. Surgical interventions, in some cases, surgery may be considered such as penile implants for erectile dysfunction or gender confirmation surgery for gender dysphoria. So these are the general management in the case of sexual disorders. Now we are coming to the nursing management of psychiatric disorders. As a nurse or psychiatric nurse, what is your role? What is the management? First is therapeutic communication. Engaging active listening, empathy and also non-judgmental responses to build trust and rapport with the patient. So you should have a connection, you should have a relationship, therapeutic relationship with the patient to get their trust towards you. Next is medication management. Administer prescribed medications, educate patients about their effects and side effects, effects on side effects and monitor adverse reactions. Also behavior therapy. Implement cognitive behavioral techniques such as relaxation exercises and coping training to help patients manage symptoms and also improve the functioning. Psychoeducation. Provide education to patients and their families about the nature of disorder, treatment options and also strategies for managing symptoms. Crisis intervention. Assist during crisis of or emergencies, ensuring patient stability and also safety. So these are the general nursing management of psychiatric disorders. Next is collaboration with multidisciplinary teams. So coordinate care with psychiatrists, psychologists, social workers and other healthcare professionals to develop comprehensive treatment plans. Promotion of self-care. Encourage patients to engage in self-care activities such as proper nutrition, exercise and sleep hygiene to support overall well-being. Environmental management. Create a therapeutic environment by minimizing the stimuli, ensuring safety and promoting a sense of calm. Supportive counseling. So need to have a supportive counseling, give them, offer emotional, as a nurse offer emotional support and guidance to help patients explore their thoughts and feelings, develop insight and foster resilience. Follow-up and monitoring. Conduct regular assessment, monitor progress and adjust interventions as needed to ensure continuity of care and optimize outcomes. So these are the main role of nurse. General nursing diagnosis of psychiatric disorders. Let's see what are the main nursing diagnoses. First one is risk for self-harm related to feeling of hopelessness, impulsivity and suicidal ideation. So there has a half of risk for self-harm. So that person will have maybe suicidal ideation. Next one is anxiety related to fear of unknown, inability to cope or physiological responses to stress. Next is ineffective coping related to maladaptive responses to stressors, lack of effective problem-solving skills or limited support systems. Disturbed thought process related to altered perceptions, disorganized thinking and impaired concentration. And next one is social isolation related to withdrawal from social interactions, stigma associated with mental illness or lack of support. So these are the general diagnoses. So risk for, next one is risk for violence related to aggressive behavior, history of violence or inadequate coping mechanisms. Impaired social interaction related to social anxiety, communication deficits or difficulty forming relations. Risk for imbalanced nutrition related to altered appetite, medication side effects or disorders of eating disorders patterns. disturbed sleep patterns related to anxiety, medication effects or disruptions in the sleep-wake cycle. Impaired verbal communication related to cognitive deficits, language barriers or psychomotor agitation. So these are some general nursing diagnosis you can also study and write in the exams. Yes, so till now in this section we had discussed unit number 5 from mental health nursing. I hope everyone understood. So we will meet in the next live classes with another topics and another interesting chapters. Till that, thank you.